Good morning. I'm Jackie Galliano, CCPU's Healthcare Reimbursement Fund trustee and a UDW CCPU member. We'll have more information on me and the other healthcare leaders within our local unions. In this presentation, we'll be providing an overview of the new CCPU Healthcare Cost Reimbursement Fund, discuss Covered California's qualifying life event and what that means for you. Guide you through a demonstration of the reimbursement request form, provide an overview of Child Care Providers United, as well as addressing frequently asked questions on the CCPU Healthcare Reimbursement Fund. The best way, now listen to this, the best way to get updates on the CCPU Healthcare Reimbursement Fund is to sign up on the ccpuhealth.org and get the latest and most recent information from the Healthcare Reimbursement Fund as soon as it becomes available. Let me say that again. The best way to get the most recent information on our healthcare fund is to sign up at the ccpuhealth.org website. During this presentation, a QR code will be available on the screen so you can scan with your smartphone and access ccpuhealth.org. I'm so excited to share that CCPU Healthcare Reimbursement Fund website is available in English, Spanish, Chinese, and Arabic. Please note that signing up for updates on the website is not the same as applying for the healthcare assistance. I'm going to say that again. Signing up on the website is for information, and it's not signing up for the program itself. Everyone is urged to do that as well, either the website or which is preferred, or call and ask about a paper application. Now, as I said, my name is Jackie Galliano. I am a healthcare trustee. I am from UDW Local 3930. And also within this, all three locals within CCPU are represented. So you'll have Horace Turner, Yvonne Cottage, who you'll hear from in a few minutes, Patricia Moran, Joe Scala, and Rico Menendez. So you have your locals represented: UDW Local 3930, SEIU 99, and SEIU 521. So again, my name is Jackie Galliano, and I'm very excited that you're here this morning. I hope everybody's having a great morning. Today is the third of many more webinars and info sessions that we will have with our groundbreaking CCPU Healthcare Reimbursement Fund. To view past webinars, you can visit ccpuhealth.org/resources. The presentations are available in English, Spanish, and Chinese. Today, we will review the CCPU Healthcare Reimbursement Fund Plan, the eligibility requirements, and guide you through the reimbursement request forms. There will also be a time for questions at the end of the presentation. As I said earlier, we will have many more sessions, and there is a phone number on the website if you have any questions that you'd like to get addressed in that way also. CCPU won $1 million annually from the state of California to help pay for eligible health care for providers to reduce or eliminate healthcare expenses. Let me tell you why that's so exciting. This is the largest healthcare one throughout the country for childcare providers. So everyone should pat themselves on the back for doing such a great job to make sure that this is happening. We survey providers and understand exactly what the barriers are, where it's to accessible and affordable healthcare, so providers can work and enjoy their lives. The survey confirmed that providers have been organizing for years, and healthcare premiums and out-of-cost pockets are far too high for providers to get healthcare you need and some of the affordable healthcare insurance at all. So this is very exciting. So we want to make sure that everybody has this information and you take advantage of what you fought for. CCPU Healthcare Reimbursement Fund is designed to address problems for eligible providers. Simply put, it's a cost assistance program, should cover most out-of-pocket costs you are currently paying. Meaning dollars back into your pocket. And we hope this means providers will be having better access to healthcare. It is important to know that the CCPU Healthcare Reimbursement Fund benefits works with your healthcare plan. It does not replace your healthcare plan. This allows us to cover more providers with available funding. The CCPU Healthcare Reimbursement Fund will cover benefits for eligible providers for expenses such as healthcare plans out of pocket, including medical copays and deductible, pharmacy copays and deductibles, and some healthcare monthly premium expenses. Remember, this is money that can go back into your pocket. This is a reimbursement plan. The CCPU Healthcare Reimbursement Fund does not provide medical health insurance. It is not. I'm going to say that again. It is not a medical healthcare insurance plan. It is a reimbursement plan that works in conjunction with your medical healthcare insurance coverage. In fact, you cannot enroll in the CCPU Healthcare Reimbursement Fund unless you have a qualified medical health insurance plan. Here's the thing. We know that this is a lot of information. That's why we encourage everyone to visit the website and also call in. So you cannot enroll in the healthcare plan reimbursement fund unless you have qualified medical health insurance. And if you are not insured, you will need to enroll in a qualified medical health insurance plan available to you. So please, I'm going to keep saying it to make sure everybody knows, right? Visit us at ccpuhealthcare.org/help enrolling for assistance enrolling for a qualified medical health insurance plan. Okay, so what is this? It's a reimbursement plan that works with your medical plan. This plan reimburses eligible providers' expenses such as medical copays and deductibles, pharmacy copays, deductibles, and health plan monthly premiums. One of the greatest advantages of CCPU Care Reimbursement Fund is that the benefits are available for every eligible provider, regardless of what type of qualified health plan you have. Benefits available for people on covered California, Medi-Cal, Medicaid, Medicaid Care Advantage, both Medi-Cal and Medicare, also known as Medi-Medi plans and employee-based plans. And for those of you who are uninsured, we can help you to enroll in a qualified medical health insurance plan. Who is this for? The CCPU Care Reimbursement Fund is for eligible child care providers such as yourself that meet the eligibility criteria of working with subsidy children for 3 to 6 months for the initial eligibility. Enrolled in a qualified medical health insurance and submit and complete CCPU Healthcare Reimbursement Fund application. When does it start? Benefits were available as of January the 1st, 2023, with the delay start in processing and reimbursement. This means you'll be able to be reimbursed for covered expenses for January 2023. After you meet the eligibility requirements, applications are available today. If you haven't filled one out, fill one out. Please go to the ccpuhealth.org/apply to enroll in the CCPU Healthcare Reimbursement Fund. For those that have already applied, we thank you for completing your application. You will start to receive updates on eligibility status as early as next week. Let me say that again. For those of you that have applied and for your application already and you're in, we'll get back to you status, you'll start getting updates as of next week. So how do I access the program? Eligible providers. Let me take a sip of water real quick. Sorry, you guys. This is a lot of information, but it's good information. How do I access? Eligible providers will be able to utilize their benefits by either swiping a debit card or an eligible expense for an eligible expense, or submitting a request for reimbursement and receive a check or electronic reimbursement. It is important to note that we are not processing reimbursements as of yet, but will be shortly. To get updates on when the CCPU Healthcare Reimbursement Funds will start processing reimbursements, please sign up on the ccpuhealthcare.org to get the latest and most recent information from the Healthcare Reimbursement Fund as soon as it becomes available. So, as we said, the most important thing is always visit the website because you'll get the most updated information from the website. So where can I get more information? Again, the website. The website is going to be your friend. And be sure to sign up to get the updates via text or emails. So you may be also, you can also email support@ccpuhealth.org or call 833-714-6028. And as I said, there is a lot of people who are now like texting us right now and saying they didn't get this information. So if you hear of any providers that says, I wanted to join, but I couldn't join today, please give them the website information because all of this information will be on there. Okay. It's Yvonne. So I am going to introduce you to Yvonne, who is also a member of CCPU and a good leader. And right now, just before I bring Yvonne on, I would love to stay with everyone on here today. But today we are making history within CCPU. We are having our first bargaining session, in-person bargaining session with the state. So you have your union brothers and sisters who are on your bargaining team that is meeting with the state right now for our second contract. So I'm going to give it to Yvonne and I'm going to sign off so I can also join in with them. So again, if you haven't applied, apply, but make sure you visit the website. Yvonne?
Thank you so much, Jackie. Yes, that's it. Super exciting. Negotiating, not just negotiating with the state, but in person. So good morning, everybody. Thank you for being here. My name is Yvonne Cottage, and I am a member of CCPU and our local, SEIU Local 99. I am a family child care provider from Lancaster. I've been doing childcare for over 15 years, and it's my pleasure to be here with you all this morning. So I'm going to talk a little bit about what the health plan is and what it isn't. So the CCPU Healthcare Reimbursement Fund is a reimbursement plan that works with your medical plan. This is not an insurance. It does not replace your medical plan. So this is super important. So please do not cancel your health care plan. Do not cancel your health care coverage. You sign up for the health care fund to help you pay for your share of the cost of your healthcare plan. And so this means that any eligible expenses that your health insurance plan does not cover, the CCPU Healthcare Reimbursement Fund will reimburse providers for all of those out-of-pocket expenses. How do you become eligible for the CCPU Healthcare Reimbursement Fund benefits? There's 3 steps that you'll have to take that we're going to review here on how to become eligible for the benefits. So first, you must be paid for work with a subsidized child. Second, you must enroll in the qualified medical health insurance plan. And third, you must enroll in the CCPU Healthcare Reimbursement Fund by completing the CCPU Healthcare Reimbursement Fund application. We have a great video available on our website that can guide you through this eligibility requirement for the CCPU Healthcare Fund Reimbursement Fund Benefits Program. So please visit our website at ccpuhealth.org/resources. So there will be a link in the chat for you on videos. So please go ahead and watch the videos, go to the website. And applications are now available on our website at ccpuhealth.org. You can submit both online and by paper. However, online is the best and fastest way and the easiest way to apply. Paper applications are available to download on the website, and you can also request an application to be mailed to you. Please call our customer service number at 833-714-6028. You will also see a nice little QR code on the screen right now that you can take your phone and take a picture of it and click on the link, and it'll take you directly to our website as well. And there should be a link in the chat as well to click so that you can apply as well. So next slide, please. The CCPU Healthcare Reimbursement Fund has received several calls regarding 2 of the security measures that we have in place for the online application. So the first scenario is when a user requests multiple email verifications and then clicks on the verification link, and in the very first email that was received, probably expired. So this produces an error, which in turn causes the firewall to show you've been blocked message. It's important to know that the verification links expire 1 hour after your initial request. So if you clicked on it, walked away, and you come back, that link is probably expired. So if you requested the new link, the old one is not going to be valid anymore if you took longer than an hour to get back to your phone or your computer. So you will need to click on the most recent verification link. Okay, if you walked away and came back, you cannot click on the first one. You have to click on the newest one. So in order to resolve these steps, in order to resolve this issue, we're going to go over the steps. So first, you want to delete all the previously sent email verifications to make sure you're clicking on the newest link. 2, you want to visit the https://portal.ccpuhealth.org/ and log in. So you want to log back in. You want to request a verification email to be sent. Then you want to log into your email and click the verification link that was sent. Okay. And you will also see some links in the chat to access the application portal. So the second scenario, this is when a user visits the login page but doesn't log in. So the browser remains open on your computer. Later on, you go back in and you try to log in. So this also produces an error, which in turn causes the firewall to show a message that you've been blocked. So in order to resolve this issue, we're going to follow the next steps. If you logged out, you want to log out if you were logged in. So first you want to log out. You want to close the web browser and you want to relaunch it. Then you want to go back to the website, portal.ccpuhealth.org, and you want to continue. If you refresh your page when you're encountering this issue, it should also resolve it. These scenarios are security settings that CCPU Health Care Fund the CCPU Health Care Reimbursement Fund has put in place to protect your data from cyber attacks. So we appreciate your patience as we take every measure available to protect your information online. So in order to be eligible for the CCPU Health Care Reimbursement Fund benefits, starting January 1st, 2023, you must enroll in a qualified healthcare plan. If you missed Covered California's open enrollment for the 2023 plan, don't worry. Covered California has eliminated the February 28th deadline. So this is great news, you guys. Most people have to get their health insurance within the enrollment period. And once that enrollment period is over, that's it. They have to wait till next year. But for all of our CCPU members, for everybody here, that deadline has been eliminated. So now CCPU providers can enroll at any time in the qualified healthcare plan. For example, if you're not on Covered California and you want to sign up to be eligible, you can do so. If you're on a bronze or gold plan and you need to switch over to the silver HMO plan, which is the requirement to receive the CCPU benefits, now you can switch at any time. So if you need help enrolling in the qualified health plan, please visit www.ccpuhealth.org/help enrolling. And there's additional resources on the website for you as well if you are looking for the qualified healthcare plan, if you need someone to assist you with that. There are agencies that are listed on the website, and these agencies that are listed are not only approved by Covered California to assist you in enrolling in the Covered California, but they also know about the CCPU's Healthcare Fund, and they can provide that information to you as well. So to get assistance on enrolling in the qualified healthcare plan, please visit the link in the chat. I'd like to take this time to introduce Pinnacle Claims Management, Inc., which is the CCPU Healthcare Reimbursement Fund's third-party administrator. And Pinnacle will handle all of the administration of the healthcare fund, including the eligibility, verification, the reimbursements, customer service, and a lot more. And we have the amazing Bobby Moore, Vice President of Key Accounts, here to talk you through the reimbursement request form.
Great, thank you, Yvonne. So happy to be here today to talk about this form and about this program. So this particular form is the reimbursement form, the request for reimbursement form for all of your medical expenses that you might have to pay out of pocket. So I'm going to go through this form with you, and there are two ways that you can submit your expenses. It'll be this form, and then later in the month of April, we'll be talking to you about the debit card that will be rolling out. But today we're going to talk about the request reimbursement form and how you can utilize it, how you can access it, how you can submit it. And we're going to go through line by line, field by field. So what is it? So the request form is to request a reimbursement for covered medical expenses. And those include your copays, your deductibles, your pharmacy copays, and your health plan premiums. So it's really important that you all understand that these forms and this benefit is for providers only. It is not for their family members. So it is only for providers. Next. So this is where you can find the form. Where is the form? You can find it on our website, and you can see here on the left-hand side down at the bottom, it's down there in green. It says it's in English. It'll also be available in Spanish. So for those of you who would like to submit in Spanish, it'll be available for you. You can use the QR code that you just saw at the bottom of that to go ahead and link directly towards that form should you choose to use it. They're going to drop a link in the chat as well. So any way you want to get it, we're going to be able to give it to you today. When are you going to submit this reimbursement request form? So once your application is approved, and we've had a lot of questions about that, and Yvonne addressed it as well, letters will start to go out next week. So you'll start to know next week, as we're getting through all of these applications, whether you're approved or not, or whether we need additional information. Once you've been approved, you can immediately request reimbursement for expenses that you've incurred since January of this year. And so this you have, and you'll see the note on here, you have until next year to submit. So once you're deemed eligible and you have expenses, you have until March 31st of next year for any expenses that you incurred in 2023. So let's talk about this particular information and every single data field on this form. So the very top part of this form is about you. It's about the provider. So we want to know your information and your healthcare fund ID number. This is really important. So you can see here, we want to know about your name, your address, your city, your state, all the good stuff that we need to be able to reach you. But that member ID number that's right there, that's the CCPU Health Care Fund ID. And you will get this number in your welcome letter. So once we've approved you and you get a little notice that says, hey, you're approved, you'll actually get a welcome letter for us that will tell you how to access your benefits. And one of the things that you'll get is your member number in that particular packet. So you don't have it today. Anybody who's looking for it today, you won't have it. But when you get that welcome letter, it'll be prominent on there. And that is the number that you will use going forward in any of your requests for reimbursement. So what are the expenses that you can put through on this form? So we're going to go through at a very high level, and then our website does have additional information for you should you choose to want to go and look at some expenses that would be eligible for you to be requesting reimbursement for. So the first one here is a premium expense. And for most people, this is one of the most expensive parts of healthcare, is how much you pay for the actual medical insurance. So this is where you would click the premium expense bucket, or box, I should say. It's not a bucket, a box. And you would attach your premium statement bill that you get every month. That will be your receipt. The next one here is your out-of-pocket medical expenses. So when your qualified health plan, your medical insurance plan begins to pay, they will tell you what they're going to pay, and they're going to tell you what's left over. So what's left over, or what you have to pay out of pocket, what they don't cover, is what you would submit to us in your receipts, right? So you check the box out of pocket medical expenses, and you would submit that receipt in, and we would pay you for what the medical insurance did not cover. And then for permissible expenses, and this is only for Medi-Cal participants. So for those individuals who have Medi-Cal insurance, they're the only ones who get permissible expenses. And this would be where you would click the box for those. And on our reimbursement form, you will see a list of some of those, and there will also be a list of those on the website should you choose to want to go take a look at those. Expense information. This is really, really important. So the more that you can give us information on this form, the less opportunity that we have to come back to you and ask you for additional information. So the more complete it is, the more filled out it is, the better it's going to be. So at the top, we're going to talk about the provider's name. This is the name of the company or the doctor that actually performed the services. It could be for an X-ray. It could be a medical group. It could be Dr. John. So this is the person or the entity that actually provided the services to you. For premium month, this is for the month that you paid the premium for. So if you got a bill in January for February and you paid it at the very end of January, but it's for February coverage, the month would be for February in here. Okay. And the date of service, this is the date that it actually happened. So for a premium, you would just put February in our example and you'd be fine. But for a out-of-pocket medical expense, they want to know the date of service. When did you actually go to the doctor and that service was performed? Health plan carrier, that's the name of your medical health care insurance. So that would be your Blue Shield, your Kaiser, your Medi-Cal. It could be Medicare, it could be Medicare Advantage. So your health care carrier's name. The service provider, we've already talked about that. That's the individual or the company that's actually performing the service, and the amount. Now, the amount is what you're asking for us to reimburse you for. So this is the amount that you had to pay out of pocket, and you would like to be reimbursed for. So that's the amount that would be in that particular bucket. After you have completed the top part of the form, which you provided your provider information, you've given us the information about the expense that you're looking for to be reimbursed, then we need you to sign and attest. So this is making sure that you understand that what you're giving to us is factual to the best of your ability and your knowledge, and you're going to sign and date it and submit that form. So what do you need to process the reimbursement request form? So this is kind of like a list of some things that you will need to have. So you'll need to have the form, and there's a QR code here for you to download the form. You can go to our website and access it there. So you'll need to submit that completed form. So very much like I spoke to you about before, the more complete it is, the easier it is for us to process. And you have to attach the receipts. So it's not good enough that you give us the information. We actually have to have the receipt to be able to validate the request and be able to approve that payment and reimbursement to you. Now, how do you submit it? Here's all the ways that you can submit your expense to us today. So you can email it to us. So you can get your form, fill it out, attach your receipt, scan it in and email it to reimbursement@ccphealth.org. You can fax it to us at 949-809-3266. Happy to have that. Please include your CCPU ID number, because that's how we link everything together. Or you can also send to us via mail. We're happy to take your stuff via mail. I'm going to be honest with you and tell you that it's quicker to do it to us to email it or fax it. Mail takes a little bit more time because you're dealing with the U.S. Postal Service. Okay, now, how long does it take us to actually go through these claims? So right now we are saying it takes up to 30 days. We're hoping it won't take that long, but this is a very new program. We're learning as we're going. And so we want to manage the expectations and say that it'll take us 30 days to review your expense and provide that reimbursement back to you. Once we process it, you'll actually get a notification. And you'll also, in the future state, be able to go back into the website, sign in, and see the state of your actual request. So there's all types of information that'll be in the website once it's available, and you'll be able to see the status of all those particular requests that you have. And it looks like I'm going to invite you back up, Yvonne, to talk about CCPU provided. united.
Thank you so much, Bobby. I hope that all of you guys are finding this information useful. And you know, we wouldn't even be here if it wasn't for the 17 years that it took family childcare providers to fight for the right to unionize, right? At the end of 2019, Governor Newsom signed AB 378, which is Building a Better Early Care and Education System Act, which allowed 40,000 childcare providers to vote on becoming a union. This is huge. 97% of California daycare providers voted yes to unionizing. And let me tell you, I have a lot of colleagues around the nation who would love to be a union and want to know how California is doing it. So this win is huge, not only for California, but it's paving the way for the whole nation. And this win gave family daycare providers the right to negotiate with the state for improvements to early childhood education system. In the first contract agreement, it was $1 billion agreement, and we deserve more. And as a matter of fact, today, our negotiations team is in person at the table negotiating with the state for a lot more. And I'm here to ask all of you providers who are not union members to join us. There will be a link in the chat, and you will also see, well, you don't see it anymore, but there was a QR code up, but there is a link in the chat, childcareprovidersunited.org. And you all should join the union, because there's so much more that we need, that we deserve. And there's just so much more that needs to be changed, that needs to be fixed, that needs to be corrected, such as rate reform, meaning we should be getting paid on the true cost of care, not by the regional market rate, and reimbursing providers based on the child's enrollment, not the attendance and when they show up. Also, eliminating those parent fees that are a hardship for parents, eliminating those permanently. And let's not forget about the retirement fund that we are still fighting for. We need every provider to take action and join our union, Childcare Providers United. Join us when we have actions, when we have rallies at the state capitol, so that we can show the state how united and powerful we are. When providers organize and use their collective power, we can force those decision makers, from the governor to the legislators to wealthy corporations, to pay more attention. Don't forget, there is a QR code on the screen. You can take your camera, take your phone, take a picture of it, click on the link, and there should also be a link in the chat as well. We need all of providers in California to join and use their voices on the steps of the state capitol, so that the decision makers really see us and they really hear us. We really want to agitate them so that we can get what it is that we have so long been fighting for and deserve. When we go to Sacramento, we make our presence known. And when we fight, we win. We make things happen by working together and being united. So far, we've won such things such as our first COVID agreement, 14 paid days of COVID relief. Our second COVID agreement was 16 paid days. We also won funds for mental health, supplemental pay. I know that was huge for providers during this last year. We also won 40 million in training funds, which is now available on the training fund website. We won the infrastructure block grant, and the family childcare providers had never been included in this grant before. And of course, our healthcare fund. This is why we unionize, my friends. This is why we fight for our rights and the benefits that we have today, and the benefits that you all deserve. So we need you guys to join us, stand side by side with us in demanding the change that is so required. If you have any questions, you see the QR codes on the screen. If you have any questions regarding the union and anything regarding the union, put them in the Q&A box along with your phone number and email and your address, and an organizer will contact you. I know for me personally, before I joined the union, I felt lost. I, felt lost in navigating all the complexities of running a small business. And I had a lot of questions, and I was all by myself trying to fight the agencies and get paid timely. We used to never get paid on time. Can you believe that? Working hard for a check and not getting paid on time? But then I joined the union, and they've been fighting for us ever since. We have been fighting for all providers in California. And remember, when we fight, we win. Now I'd like to take it back to Ms. Bobby Moore, who's going to answer some more of your frequently asked questions and answer any questions you have on the CCPU Health Care Reimbursement Fund. Ms. Bobby?
Thank you, ma'am. All right, let's go on to the first one that we have. Does the CCPU Health Care Fund provide health insurance? You've heard this answered several times by both Jackie and Yvonne, and we will answer it again. No, the CCPU Health Care Fund does not provide health insurance. It is not a health insurance plan. It's a reimbursement plan that works with your health insurance coverage. And as Yvonne mentioned earlier, you can't participate in our fund. You're not eligible for benefits if you're not in a medical plan or qualified medical plan. Okay, next question. What do I need to complete the application for CCPU Healthcare Fund? This is pretty easy. You need to complete your application. You need the following information. You'll need your profile information. That's your information about where you live, your date of birth, that kind of good stuff. Information about your medical health insurance plan. As we mentioned on the previous slide, you must have a medical plan in order to be eligible for this particular benefit program, this reimbursement fund. So we need to have a copy and be able to have proof of coverage for your medical health insurance plan. What information needs to be displayed on your medical health insurance proof of coverage? This is really important because not every card has all of this information. So it needs to provide your name, the provider's name, the name of the health plan. Is it a silver HMO? Is it a bronze PPO? We need to know what's the name of the healthcare plan and the coverage period. So what your coverage period meaning for 2023, we need to confirm that you have actual medical coverage during 2023. So those are the things that you need to be able to provide proof of coverage, those three pieces of information. What is the deadline to apply for January initial eligibility period? We mentioned this in our previous webinar. You will also find this information on our website. The deadline to apply for January is June 30th. So if anybody is waiting to the last minute to apply, you can do that on June 30th. And if you are eligible, then the reimbursement would be effective back to January 1st. So it would be retroactive to when your eligibility started. The other thing that's on here, and I don't want to spend a lot of time on it because it'll become a little bit more apparent as we move through the program. So there's the initial eligibility determination, which is what we're talking about today. And once you have initial eligibility, then it's the continued eligibility, which is you must continue to work with a subsidized child and receive a payment in one of the 3 months for the eligibility period. You can find that grid on our website if you're interested. Right now, we're very solely focused on that January date. So it's the 3 out of 6 months that you need to be paid for working with a subsidized child. How will I know if I meet the eligibility criteria by being part of the child care subsidy program? Okay, so our eligibility calculations are done monthly. So once you complete your application and we validate that you meet the eligibility criteria, we'll let you know. We're going to let you know it's not a secret. We want you to participate. We're going to send you a welcome letter. And as I mentioned previously, that welcome letter is going to have some very specific information in it. One of those being your member ID. It'll also be a reference for how you access your benefits. So when you get that welcome packet, and we hope all of you get the welcome packet, all that information will be available in there, not only for your eligibility, to be able to access your benefits, but it'll also talk to you about ongoing eligibility. Are the benefits from the CCPU fund taxable income to the provider? The short answer is no, it is not. I could read you all these words on the page, but the short answer is no. This is a good one, and this is a question that we're getting a lot of. What if there are multiple providers on one license? Who's eligible? So right now, the way that the program works is if there's multiple people on a license, the first one that accesses or submits an application would be the person who would get those benefits. So this program is very rich in its benefits. It's almost too good to be true. The benefits are so rich. And so a lot of people are going to want to participate, where we're hoping for anyway. And so at the current year, in the current benefit year, it's one provider per license. And I think the trustees would very much like to expand that perhaps in future years, but for the current year, it is one provider per license. Here's another one we get a lot of. Are dental and vision benefits available? They are not. Right now, this is for medical only. And again, as I said to you in the previous slide, the benefits are very rich for this program, but the trustees are really looking to see if there's ways that they can expand the benefits. And this is areas that they're considering. So not today, but perhaps tomorrow. Tomorrow meaning in a future plan year, not actually tomorrow. Okay, so I have several questions that have come up, and these are ones that have came up that you guys have submitted to us, and I wanted to take an opportunity to answer some of them. They're not pre questions that have come up. They're ones that were submitted for this specific webinar. So I want to acknowledge a couple people and to read their questions out here real quick. So the first one came from Rosalva Alvarez. I apologize if I don't say your name correctly. Her question is, do you qualify if your spouse has insurance through their job? And the answer is yes, if you are covered underneath your spouse's insurance. So on the application, you would collect employer coverage, employer-sponsored coverage, and you'd click as a beneficiary, not as the employee, but as a beneficiary, a dependent. That's what I'm trying to say. So if you meet the eligibility requirements, you would go ahead and click that box. You would be eligible for up to $87.50 in out-of-pocket, and I believe because it's an employer-sponsored plan, up to $100 per month for premium, any out-of-pocket that you may pay for your part of the premium to participate in that particular plan. The next one I have on here came from Adrian Rombo. Once we sign up for the benefits, what is the time frame for reimbursement? It's a great question, and we talked about it a little bit before, but let me talk about it again. Once you've submitted your application and we determine your eligibility, you'll get a letter from us. And like we said previously, those letters are going to start to go out next week. Once you've been approved, you can access your benefits immediately. You can submit the form that we've been going through today and request your first reimbursement. Let's see here. The next one I have in here is for Gloria. I'm going to try to say your last name. I apologize if I don't do it well. It's Delgadillo. What form should we send? I have a receipt that comes monthly to give my payment. Can I scan the receipt and send it? Thank you, Gloria. Great question. It kind of goes back to what we were talking about previously. If you get a bill every month, and most people do, for their premium, for their medical health insurance premium, their monthly premium, that is exactly what we need for you to submit to us to be reimbursed for that premium. Absolutely perfect question and a perfect response to get your reimbursement. The next one I have on here is from Amelia Santana. I already have Medicare and supplemental insurance. Do I still qualify for the reimbursement? The short answer is, as long as you meet all the other eligibility requirements, meaning you work with a subsidized child and you meet that initial eligibility, absolutely. Medicare is a qualified medical plan and you would be eligible if you meet all the other requirements to participate in this plan. Absolutely. And so there's a number of benefits for Medicare. At a high level, it's the $87.50, but there's also help for Part B and Part D. So there's a good, healthy benefit for Medicare participants in this particular fund. Let's see. We're getting a lot of questions about application status. We mentioned this a couple times before, but I think it's kind of good to say it over and over again, just so you guys, it resonates and you can hear it. Application approvals will start to go out next week. So no one's missing anything. They're going to come out next week, and then there's going to be, and then you'll start to get your welcome letters and you'll start to get access to your benefits. The last one I have on here, because it looks like we're getting close on time here, is from Angelica Carter. What form will the reimbursement be in? Check, Visa card? How do we get reimbursed? Another great question. So initially you'll be reimbursed via check. And then shortly thereafter, we'll be asking if you'd like to have it be via check or via direct deposit, or ACH, you might hear it called. And there's also, when the debit card comes up, there'll be an opportunity for the debit card to be utilized as well. So there's 3 ways that you will be able to get your reimbursement: check, direct deposit, or using the debit card. Okay, I think that was all the questions that I had queued up here. What is our next slide? Great. So we want you to stay in touch. We want you to get information from us. So as Yvonne and Jackie mentioned previously, we really, really want to hear from you. If you'd like to get updates from us, please go onto our website and sign up for updates. Again, I want to reinforce that signing up for updates is not submitting an application for fund benefits. 2 separate things. If you need to reach us, you can reach us at support@ccpuhealth.org, or the phone number. We're there 8 to 5 Monday through Friday. Happy to take your call. We do take these calls in language. So if you are a Spanish speaker, an Arabic speaker, Chinese speaker, English speaker, we will take you all. Give us a call. We're happy to take those calls from you. Next slide. And we are at the end of our presentation. Thank you all so much for being here. Again, I want to reinforce that we want to hear from you. Please visit our website, sign up for updates. Our next webinar will be April 1st, and it'll be talking about the debit card. So we look forward to seeing you guys there. Thanks so much.